Bell Ribeiro-Addy.
Thank you, Madam Deputy Speaker. I rise to speak overall, obviously, against the bill, but in favour of new clauses 56 and 57 in my name, and those amendments and new clauses in the name of any member who has sought to change the pernicious outcomes of this bill. Our NHS is really one of the best things about this country, but this bill is the biggest threat to it yet, rolling out the red carpet for private companies, ramping up this government's long-standing attempts to privatise the NHS and making it easier for what we've witnessed over the past 18 months, which is contract after contract awarded without competitive process and failing companies rewarded with new contracts again and again. This bill would be the destruction of our NHS as we know it, and it will widen the inequalities that the pandemic has already exacerbated. We now have over 5.7 million people on NHS waiting lists. Of course, this is not solely because of the pandemic. Far from it. In 2010, after the government won the election, there were about 2 to 3/4 million people on NHS waiting lists, but these have risen every year before the pandemic. So it's the long-term effect of Conservative policies of underfunding and privatisation. But waiting lists have now doubled, and our NHS is now in danger of toppling over. All the while, health inequality is rising, and that's why, with the support of the Health Foundation, I've tabled new clause 57, which would compel the NHS to set out data collection guidelines on health inequalities. We know they exist. We've seen them play out with the worst consequences, from postcode lotteries to racial disparities, and it's time we accepted this, collected the proper data, and actually set about real change. It's a farce that we don't already do so. Since 2010, improvements in life expectancy in England have actually slowed more than any other country in Europe, and the gap in years that people can expect to live with good health has widened even further between rich and poor. And during the pandemic, this was shown by higher death rates amongst people living in more deprived areas, and for certain populations, more notably disabled people and people from Black, Asian and minority ethnic communities. And for people younger than 65, the COVID-19 mortality rate was almost 4 times higher for the 10% living in the most deprived areas than those in the least deprived. Now, this is nothing new. The Marmot Review have covered this many times. And earlier this year, the King's Fund for the NHS Race and Health Observatory has actually found that any success that we've had in tackling health inequalities is always drowned out by other strains like waiting times and other clinical priorities. Put quite simply, we can't tackle inequalities because this government has never put equality at the front and centre of its policy making, which makes its so-called levelling up agenda meaningless. Now, this bill enshrines this so-called new triple aim to promote all of these different factors, but the government is so short-sighted it's declined to incorporate health inequalities into the triple aim. And what a complete missed opportunity that is, or a clear indication that the government couldn't really care less. Before anybody says any different, and that the NHS has other means of doing this, we need to look at the state of the outcomes, and clearly that what's happening isn't working. The government has continuously and repeatedly failed to accept institutional discrimination, let alone meeting its duties under equalities law. And we've heard recently about the issues of oxidometers and dark skin and how these would have contributed to worse outcomes. And so the Secretary of State for Health has called for a review into gender and race bias in medical equipment, which is quite frankly groundbreaking, because that's all we seem to do, have reviews. This is the type of policies that we would have if we just heeded the government's reviews gone past, and if we just looked at our equality impact assessments. Madam Deputy Speaker, there's no excuse for the government to keep ignoring what is already set out in law and in terms of meeting the equalities duties to people right across this country. Thank you.